An apple a day keeps the doctor away.
ER24 brings you Health Minutes with Dr Holgate. A man in his 20s is in a critical condition after he sustained severe burns in a veld fire in Tulisa Park on South Rand Road in Johannesburg South this morning.
That was a story published recently that got me thinking about the subject of veld fires in general. On today's podcast, we chat about the clinical significance of stories of this nature with Dr. Holgate. Not only that, former fireman and ER24 West branch manager joins us on the line to give us his insight on the broader issue of veld fires. Hentie, thank you so much for joining us.
It's a pleasure, Luanda. I'm glad to be with you.
Dr. Holgate, thank you once again.
My pleasure.
Okay, let me start with you, Hentie. Have always wondered why veld fires was started in the first place, and my naivety led me to thinking that maybe they were a mechanism to clean up unused land. Am I correct?
That's correct, yeah. There's a couple of mechanisms towards veld fires. These mechanisms, if I can just iterate on the mechanisms of these veld fires, there are a lot of rubbish that gets dumped into veld fires. So at the end of the day, these rubbish can heap up and actually cause spontaneous combustion as well. And this is how these veld fires also usually start.
These veld fires are not a common thing, and although most of them are started accidentally, some are deliberately set under controlled circumstances by professionals. Please explain this for us.
Yeah, usually it is started by professional firefighters to basically make a fire break. So basically it will be a break between an area that is burnt, or that is not burnt, and a area where there's cattle or anything like that that they want to protect. The area is being burnt is about almost 5 meters in width. This is so that if a fire breaks out on one area, that it will get to a point where the fire will starve out and does not have anything to burn anymore, so that the cattle can be protected on the other side. It is also being done when there's a lot of thatch roof houses in the area, where they want to protect those thatch houses, so that they don't burn.
Fires can be started under different circumstances, like, houses or vehicles that were involved in collisions.
Oh, definitely. Vehicle fires is a common thing that happens, especially when we've got these old vehicles that is running around, the wiring and everything that's not being maintained by the owner of the car, and that can happen as well. House fires is especially common in the winter times, where people use a lot of devices to keep hot in the winter, and electricity being used over excessively.
On the issue of safety, in your experience, what is the propensity for people getting injured in fires?
The common part, especially with your veld fires, is your people that actually lives. They are people that do not have houses. They live in the veld, and by the time that they realize that there's a fire in the area, they want to protect their possessions. So they want to grab onto their little bit that they've got. And usually if the wind is a bit fast, that would push it into them and they would not get chance to run. It's the same that happens with house fires as well. People want to protect their belongings, and they want to grab this, and then they get the fire is too fast on top of them. And this is where the people get burnt in this instances.
Thank you very much, Hentie, for taking time out of your schedule to join us on the podcast. We really appreciate your insight.
It is my pleasure, Luanda. Thank you.
I'm going to continue with Dr. Holgate, and we'll chat to you later. Dr. Holgate, we have Hentie who's chatted to us about veld fires and basically set the context for our discussion. From a clinical point of view, why is it important for a medic to understand burns?
There's a huge amount of physiological things that happen in our body as a result of burns. You lose a lot of fluid because the barrier between your organs and your external environment is actually damaged through burns. Also, what we see on the surface isn't necessarily what's going on underneath. So there's a lot of pathology and physiology that we actually need to manage.
Okay, we've also heard the term third-degree burns used quite often. What does it mean?
Johanna, third-degree burns is actually now a obsolete term. We now classify burns differently. And the way we classify them now is either superficial or superficial partial, and then deep partial and full thickness. So just to go through them in a little bit more detail, superficial burns are generally the burns that you have from sunburn. They are dry, red, they blanch with pressure, and they're very painful, and they heal within 3 to 6 days, normally on their own. Then superficial partial thickness, these are your scalds or spills and splashes from, for example, hot oil. They generally present with a blister. It's moist, red, it weeps a little bit, and it also blanches with pressure. They're very painful to temperature and to air. And they heal normally within a week to about 20 days for the slightly bigger ones. Then deep partial thickness burns. Those are again your flame, oil, and grease burns. They have blisters. They're wet or maybe slightly waxy dry. They don't normally blanch with pressure. And the sensation and they're perceptive of pressure only. And they generally heal within 21 days. Now your full thickness burns are the ones where you feel very little pain or only feel pain with deep pressure. And they really don't heal on their own. They generally need to have specific medical intervention, for example, skin grafts to assist with healing. And they really do involve sort of epidermis, dermis, subcutaneous fat, and then even as far as into muscle, if that's over the area that was burnt.
Okay, so if the different layers of the skin are burned severely enough, it can really reach the muscle, which lies very deep below the skin.
That's really now the old fourth-degree burns, which is full-thickness burns now.
Okay, perfect. What about pre-hospital treatment? What are the procedures that medics ought to practice?
Our treatment of burns patients remains the same as for any approach to a trauma patient, which is really we have to manage the airway, breathing, circulation, disability, and then the environmental care initially. And probably one of the most important things about burns is there inhalational injury? If there is inhalational injury, the patient requires early intubation and lung protective ventilation. Then the next thing we move on to, then obviously we'll continue with airway and breathing interventions. Then from a circulatory side, just remembering the amount of fluid that can be lost, as I mentioned, through this barrier, plus all the outpouring of fluid into the cell tissues. These patients are heavily fluid dependent. The way we calculate that in the pre-hospital environment is to use the modified Brooke-Parkland's formula. And that really gives us a guide of how much fluid is required for the first 24 hours. Then just to remember that there are circumferential burns, which could in fact, by circumferential I mean that they surround the chest or the arm or something, they could in fact result in a circulation change to that distal limb or even to the chest, if you're talking about ventilation. So those need to be intervened urgently. And then, obviously, other than the third-degree burns or full-thickness burns are very painful. So our team needs to remember to administer adequate analgesia. And then finally, just consider the special problems. For example, the extremities, the facial burns, the extremes of age, lightning, that's also a burn. And then make a decision about transfer to definitive care.
Okay. In the story that we started the podcast with, the patient was flown to hospital because he was severely burnt. When do we fly a patient, Doc?
Sure, I'm glad you asked that question, because obviously the mortality with 100% burns is exceptionally high, around about 100%. So so we really, unfortunately, don't want to fly those patients because there's very little prognosis. So our cut-off criteria usually for flight are between 30 and 60% burns. And those are because those are the patients that we can make a difference for. For pediatrics, we're slightly more lenient, 20 to 70%, but generally between those percentages are the patients that we really should be flying.
And who are the people that we have at ER24 who are tasked to make those decisions?
Our doctors that are on call for the company make the decision around which patient should be flown or not. We have a team approach where we chat to the paramedic on the scene or the service provider on the scene, and we then make the call as to whether or not the patient meets flight criteria.
So it's important for the medics to give you correct information so that you can make the decision properly.
Absolutely.
Okay. Which patients should be transported to the closest hospital and which must be transported to a burns unit?
I think any patient with a major burn, which in other words is more than 30%, burns involving the extremities, burns involving the speciality areas, for example, eyes, ears, face, hands, feet, perineum, they should really be transported to a speciality burns unit if possible. Also the high voltage electrical burns, lightning, burns with associated major trauma, and any poor risk patients and extremes of age should really be transported to a specific burn care facility.
Well, thank you so much, Doctor. I must say I've learned a lot in today's podcast, and I really appreciate you coming in with all of that insight for myself and our listeners to learn from. Anything else you'd like to add?
I think we need to make sure that everybody is safe and prepared for a fire. So if you do have a gas stove, for example, at home, please make sure that you have a fire extinguisher nearby. Make sure you're always prepared and prevent fires as much as possible.
And it's important for companies, for corporates or organizations to make sure that their fire marshals are adequately trained to deal with instances where fires break out and they're unexpected. Thank you once again for listening to our podcast. Please stay tuned or look out for our new podcast coming to you soon.